Hi, Parenting Skills students. This is Mrs. Boland. Welcome to the first part of our Chapter 16 study guide. Use these slides to complete numbers 1 through 8 on the front of your study guide. This is essentially self-paced, so you can watch and listen at your own pace, fill in the answers, and if you ever need to pause the video to kind of catch up with what you're writing, you can do that and continue when you're ready. So number 1 asks, what strategies are included in a wellness approach to life? So wellness is our overall good health. You can see I have 7 bullets here. It includes good nutrition and personal hygiene. These are topics we talked about last chapter. Being physically active, getting adequate rest or sleep. We know that the younger the child is, the more sleep they need. Keeping stress under control. There are studies that show that positive relationships just have a positive impact on our wellness and well-being. Things like drama and stressful relationships do affect our health. And another component that we'll follow up next on is preventive medical care. Here's number 2. What does preventive health care for children include? And there are 2 main elements. The first are regular medical checkups. These are your well visits. After age 2, pediatricians ask that children have a checkup once a year. Before that, it's every couple months. When babies are first born, they actually go to the doctor every couple of days. But it's an annual well visit after age 2. Dental checkups are a little more frequent. Those are every 6 months. Again, after age 2, once kids have a few teeth. And immunizations or vaccinations are a key component in preventing us from getting sick. And vaccines are very effective. Many threats have been all but eliminated. Things like polio that used to leave children physically disabled, diseases like the measles and mumps that could cause deafness. We rarely hear of children getting those diseases. That just speaks to the effectiveness of our immunizations. Part of that annual well visit is a developmental screening. And basically what doctors are doing is to see if children are developing physically, emotionally, and mentally at a normal rate. I know certainly the physical component, doctors want to make sure the kids are growing at a normal rate, but also that emotionally and mentally, they're where they should be for that age. And it's important to identify any problems early on and get some intervention if kids need any supports. Number 4, how might parents know if their small child is not feeling well? Well, a small child is one that probably can't verbalize or vocalize their symptoms. So we might see in the graphic here some physical symptoms. This is a child suffering from hand, foot, and mouth disease, which presents as blisters on the hand, foot, and even ulcers in the mouth. Can make kids really miserable. Some other behavioral changes parents might notice. A common sign of an ear infection is kids that aren't hearing real well, or their balance is off, or they're itching or tugging at their ear. You'll also notice kids just aren't quite themselves. They might be crying more than normal, certainly being irritable. They might not be sleeping or eating like they normally do. Number 4, list a handful of common childhood illnesses that can be treated at home. Now, these are things you might need to see your pediatrician for, but they typically don't require like a hospital stay. You might get a prescription or some medication, and we can kind of treat the symptoms at home. Things like the common cold, even a low-grade fever, a rash, diarrhea, the flu, an ear infection, sore throat, strep throat, vomiting. Now, we have seen this year a really severe strain of the flu. More and more children are being hospitalized. There have been some deaths as a result of the flu. Oftentimes, though, those are more severe illnesses that children fall to because with the flu, their immune system is weakened. So they might develop meningitis or pneumonia. Those are certainly a greater threat to their health than some of these other things. Number 6, so if we've got one of those illnesses, we're trying to take care for a child at home, what are some suggestions? Certainly encouraging fluids. Clear fluids are best, things like water, broth, even fruit juices sometimes. You might have to modify a child's diet. We want to go with something that's easy on the stomach, soft foods, bland foods. Check medications. Make sure you're using a children's formula and children's dosages. Definitely avoid aspirin. Doctors advise against giving aspirin to children. It can cause something called Reye's syndrome, which instead of making kids better, actually makes them sicker. There's an unusual combination of children with the flu or chicken pox that receive aspirin. They can develop this Reye's syndrome. 40% of patients that have Reye's syndrome will die. So it's a big threat. Another suggestion is when kids are sick, keep them home. Number 7, how should parents treat the following childhood illnesses? A cold, again, encouraging fluids. Sometimes a cool or even a warm mist vaporizer helps loosen up some of that congestion and stuffiness. Diarrhea, definitely encourage fluids. Kids could easily become dehydrated. Sometimes kids have a hard time swallowing liquids, so even if they can have like a popsicle, something to keep them hydrated. What you see in the picture here is the brat diet. Again, it's something bland, easy on the stomach, bananas, rice, applesauce, and toast. And then the flu. Something that kind of sets the flu apart is extreme fatigue and exhaustion. So encourage kids to stay put and just rest, keeping them hydrated. Doctors might prescribe something called Tamiflu to ease some of the symptoms as well. And the last one for this set at the bottom, number 8, the illnesses I just described are something that occur that we can get over, unlike a chronic illness. A chronic illness lasts a long time or comes back often. We can't cure chronic illnesses. We can just teach people to manage the symptoms. So common chronic illnesses, things that don't go away, are allergies, asthma, and diabetes. So if you know anyone with like a food allergy or asthma or diabetes, you know these are things that we can't cure, we can't eliminate them, but we can help manage and treat the symptoms. Now on your own, you'll pick up with number 9. The answer starts on page 334, and you are looking for information about making children who do need to go to the hospital a little bit more comfortable during their stay. Thanks for listening, and we'll